if it's fact or, if it's fake news, but there is whisperings in the corridors that we might be going into stage 4 or possibly even stage 5 lockdown. How's that going to impact on the economy? What does that mean? What does that mean for us as South Africans and our country?
Yes, but the first thing I have to say is that we have had a very poor public health response. We had the harshest lockdown one of the harshest lockdowns in the world. The lockdown in the first 6 months wiped out all the jobs that were created in the previous 12 years. So that is the huge economic cost of this lockdown. But what did we show for this lockdown? We've got one of the worst public health outcomes. We've had 1.1 million infections. That's about 1.8% of the population. We've had 30,000 deaths. And I'm just looking at a report now that we've had 72,000 excess deaths, according to the South African Medical Research Council. So 100,000 South Africans have died because of this pandemic. So, that's the situation we face now. So now, in terms of the second wave, I was looking at the figures. 21,800 people yesterday. About 7,000 of them in KZN, which is the new epicenter of this pandemic. And I looked, the Eastern Cape, where half of my family comes from, the numbers have been constant at around 1,000, 1,500. So I wouldn't say the Eastern Cape is the epicenter, but the Eastern Cape has got a shocking public health system that can't even deal with the relatively low numbers compared to the rest of the country. And then the second epicenter is growing in Gauteng, where I am based. So that is the situation in terms of the second wave. Yeah. In terms of you're talking about moving to level 4 and level 5, yes, that's what is a speculation. But I have to emphasize one thing. The lockdown is a sign that you failed in terms of introducing your public health measures. It is a last-ditch attempt. Now, the problem with lockdowns and why I say that they're not sustainable is that everywhere in the world, where there's a friend from Pakistan was explaining to me and what happened in Pakistan, you have a lockdown, it's successful for a while, but you can't have a lockdown indefinitely because the economic cost is exorbitant. It causes such pain in society that you have to lift the lockdown, and then you have to now see you have an easing, and then you have a surge, and then you have another lockdown. So we can't have these repeated cycles of lockdown, easing, new surge, and lockdown. So if you look at the period from the previous peak at the end of July to this lockdown, we're talking about, it's about 4 to 5 months. So if we're entering into a lockdown now in January, we could have another one in July and another one at the end of the year. That will cause complete havoc to our economy because every economist was forecasting a recovery of some sort, a weak recovery, but every economist now has to revise downwards their GDP forecast for 2021, and that is a sad situation. And I just want to say, if you thought 2020 was bad, 2021 could be worse because we could not have. We had one lockdown in 2021, which was a very hard one. But imagine a scenario where we have 2 or 3 lockdowns this year. That is just unthinkable. Yeah.
Okay. So I hear you loudly and clearly. Look, the whole idea for the initial lockdown, not only in South Africa but all around the world,
was to buy time. Yeah.
Yes, buy time to get the health, the health services prepared for the surge of corona virus cases. What you're indicating is that it hasn't worked. In the process, it has damaged our economy irreparably. It's going to take, from what I hear, possibly another 12 years to get us back where we were a year ago. In the interim, what happens to all of those young, educated and uneducated youth who need to put food on the table? Does that mean they're going to turn to a life of crime? You know, there's just so many unanswered questions, and it is absolutely
And one
frightening.
unanswered question as well that you're talking about. Let's say they announce a lockdown again. You have to, but this SRD grant is expiring. The unemployment CARES grant has expired already. You can't have a lockdown without announcing countervailing measures to provide income support to the people. One of the saddest periods I saw during this lockdown was the people fighting over food in the Western Cape. The government was failing to provide food parcels, and some people were using those food parcels to make a profit. And to me, that was one of the saddest moments of this. The government was providing inadequate food parcels, actually. I was on a panel with Mr. Imtiaz, the gift of the givers, and I discovered that he had distributed more food parcels than the government put together, which is shocking. Yeah. So I'm just saying that the government, if they're going to lock down the economy, they must provide income support to help the people. Yeah.
Well, look, the UK, the US, and I mean, in the US, they've been, they've been debating whether they give $600 or $1,000, in support.
Or $2,000. Yeah.
And I guess in other countries as well, there is financial support. Our government has been telling us there's no money left in the fiscus. What do we do? What do we say? And we're not even going to touch tenderpreneurs and corruption at all, because we know that's an ongoing sad state of affairs in our country. What do you believe is the solution? How, if we do go into a further lockdown, or even if we don't go into a lockdown, somehow the economy has to be given some, an injection, a boosting injection for us to be up and running? What needs to happen?
That's a very good question. So the most important thing that has to happen for this economy is we have to bring the pandemic under control through effective public health measures. Let me give you a scenario. So let's say this lockdown, it's going to affect revenue. Our budget deficit will be higher, and then the government has to readjust its budget numbers. And then we have another lockdown, the government has to do the same. It just keeps getting worse every single month. So we have to get out of this downward spiral. And the only way to do that is to bring this pandemic under control. And there are three ways that countries, technologies, if I want to call them that people have been talking about. The first one is what they call universal testing. Now, universal testing, I was thinking about how this could apply with South Africa. You test most of the population on a regular basis so that you can isolate the sick people. And it has happened mostly in companies like in Germany, in universities in the US, and some regions in Italy. And it has been shown to be effective where you provide regular tests. So I would say what the government needs to do, companies of a certain size that can afford it, they must test their workers every 2 weeks with rapid test kits. So that means all the essential workers, let's say the retail sector, or Pick and Pay, whatever, they must test their workers every 2 weeks, and they must isolate the people. Because the way to bring a pandemic under control, I was talking to someone who was involved in the Ebola episode in West Africa, who went to West Africa, is to isolate the people who are infected so that they don't spread it to other people. So that is the key towards ending a pandemic, is isolating the people who are infected. So that is the first thing, that we should find a way to have these rapid tests that deliver results in 15 minutes. And that is one way we can get our economy going. So if you go to your Pick and Pay or whatever, you know that everybody. So I'm just giving that as an example. The second one is what they do in East Asia. In East Asia, they do contact tracing. So what they do in East Asia, let's say there were 21,000 people infected today, and I was on the Korean disease control site last night, and they've got statistics of where the clusters happened. They will tell you that it happened in a distribution center in Seoul, it happened in a hospital, it happened in an old. So you need to do intelligence of where the infections happened. And that requires an army of community health workers that are going to be able to trace all these 21,000 people who got infected yesterday and find out what were the circumstances of your infection. Where did you get it? You got it at school? Did you get it at work? Or did you get it in your community? And then you will go to the places where the people got infected and perhaps have preemptive testing of the people where you got the infection. Or you could say, if you just came into contact with that person, you must quarantine until you show symptoms and then you test. And that's the second thing. The third one, and this is the one that everybody's talking about, is the vaccine. Now, the South African government has botched this one. You know, I listened to on Sunday with that long presentation, and whatever excuse they come up with, we see another developing country that is implementing vaccines,
okay,
Indonesia and so on.
Duma, I've talked long and hard about the whole vaccine issue yesterday with one of the doctors, and this is an ongoing conversation with us. In closing, what is your advice to the South African public regarding revival of our economy? We can't just depend on government because we know that they don't always deliver. What do we as citizens, what ought we be doing to start igniting? Hopefully,
I think we have to show compassion towards each other and not be judgmental of people who get sick and start blaming them for them getting sick. I've been in my community helping people with shopping, going to the shopping for them, helping them collect prescriptions, and sometimes providing financial support to your close family and friends, So I don't know. We must find ways and community initiatives to be able to support each other during this most difficult of time. I mean, I was reading about what happened during the Asian flu in South Africa when 3 million people died, and it is shocking, So I just think that we should, at a community level,
So in closing, your predictions for 2021 as far as the economy is concerned, given that hopefully there is no lockdown.
There will be a lockdown.
Okay, give me very quickly, give me the scenario.
Okay, the scenario for 2020 is a 2021, a further decline in GDP for the first quarter, a recovery in the second quarter, and I believe we'll go back into recession during the last two quarters. That's what my prediction is.
Okay, we will then end the interview on this very sad note, and hopefully just tell people, tighten the belts and do the best you can. Thank you indeed for sharing your thoughts with us this morning, and hopefully we'll talk again soon.
Thank you.
What makes Duma Jewelers the optimum place for your memorable gift? Is it our range of exclusive, high-end, luxurious